Hello, West Texas. This is Jason Cave, Director of the West Texas VA Healthcare System. Wanted to catch up with you all on our monthly message here. First, I want to jump into COVID-19, how that's going, the pandemic response, and our vaccination efforts. We talk about that a good amount, but need to provide that update. So the highlights are, our system has been back to 100% in-person capacity now for a month or two. So if you need an in-person appointment, if you've delayed it for any reason during the pandemic, maybe fear of getting sick or of going out or just waiting till it's over, we would just encourage you not to delay that any further. We can accommodate in-person appointments and have been doing so for a while. So please connect with your care team if you have not. Also wanted to thank everyone who's been participating in our veteran tele-town halls. We've been doing those on Thursday afternoons. We played with the time frame quite a bit, offering it at different times. Seemed like we get a good turnout when we do later on Thursday, early evening, late afternoon. So I want to appreciate everyone who's been joining. And we get a lot of good questions. Every single week we have good conversations about the vaccines, about side effects, about where we're going with COVID-19, about some of the changes we've all seen. It's an excellent conversation every single time. So encourage you to take part in those if you have not already. It allows us to stay connected even though we're not face-to-face still in the town halls. All right, so vaccines. The West Texas VA has Moderna. We've had that since the week of Christmas last year. We still have that available. That is a 2-dose vaccine. And I think a lot of folks have already taken advantage of that. I think more than about 3,500. I think we're upwards closer to about 4,000 veterans now have taken advantage of that across our healthcare system. But we also added the Johnson & Johnson vaccine to our toolkit to combat COVID-19 over the last month. Johnson & Johnson is a 1-dose vaccine, so it's attractive if maybe you are not sure if you can make it back 28 days later. It's also safe. It's also effective. If you ask which one is better, it's really apples and oranges. The way that the trials were conducted were very different, and the time frame was so different. There were variants around for Johnson & Johnson that weren't around for the original Pfizer and Moderna. So what's absolutely true is that they're both very effective at preventing bad COVID infections, and they're both very safe. So we're in a position to be able to offer veterans a choice of which of those you'd prefer. So they both have attractive things about them, but please do, if you haven't already received that vaccine, give us a call and let us know. I'll read this number twice. So our COVID-19 call center is 432-268-2564. They can plug you in and get you scheduled to receive whichever of those you prefer. Exciting update on this front. The Save Lives Act was passed recently and signed into law, and this authorizes VA to vaccinate veterans' spouses and caregivers and expands eligibility for us in terms of providing the vaccine. So this is brand new. As I'm recording this, a lot of the guidance is still being promulgated, is still being fleshed out. But what we know is we are authorized to vaccinate veterans' spouses. And we know so many of you have been asking for that for months now that this is really an exciting development. So for that as well, call our COVID-19 call center. I'll read this one last time. Here is 432-268-2564. Give us a call. We'll plug you in, answer whatever questions you may have. All right, changing gears. April is Whole Health Month. And whole health is something that is so important. It's a changing model of care. And when you first hear it, it may sound, common sense. Well, of course, you want to look at your whole health. But what's groundbreaking about this is that used to in institutional medicine, institutional care and healthcare, the person's looked at as what's the medical problem? What are you presenting with? How do I fix that? So, each little issue you're having medically is diagnosed not in a silo per se, but is diagnosed as an independent medical issue and then addressed from the kind of standard textbook, how do we address this illness or this disease. Whole health is different because it asks you first and foremost, what is important to you in your life? What are the things you do in your life that bring you joy, that make life worth living, that is what gets you up in the morning? And then addresses how we get you there. How does your healthcare get you there? So that's a little bit different than a traditional, oh, you have this problem, let's fix that. Oh, you have this problem, let's fix that. I can tell briefly, my grandfather, who was a chief warrant officer in the Army and fought in World War II, Korea and Vietnam, it was fishing. Fishing was it for my grandpa. And if there was a whole health approach when he was alive, instead of maybe having 2 extra surgeries or all these extra things where his quality of life had deteriorated, and those treatments were being done to stave off diseases, but they may have crippled his ability to go fishing. If that had been a whole health approach to healthcare back then, instead of proceeding with some of that, what they may have done differently is take a comprehensive look at his life. And I'm sure, if he were with us, he would have said, if I can't go fishing, then let's look hard at these next treatments and how we're approaching those. So I just hold that up as an example. This is what we're trying to do. We're trying to make people connect with what it is that brings them joy as long as possible. And healthcare is just a way to support you in those life goals. So April is Whole Health Month. We have a number of podcasts, resources, and Q&As coming up. So please stay tuned to our social media, our internet page, and our other sources of communication to plug in and connect with us on those things. So other than that, everybody, please stay safe, stay well, enjoy spring, and take good care of yourselves. We'll talk to you next month.